Hi, thank you so much for joining us today, and we're super excited to get to know you and hear your story. So let's start from the beginning. Can you share a little bit about how your daughter's story and when she was first diagnosed with SMA type 1?
Okay, well, that's first of all, I talk a lot, so I'm sorry if I extend the story, but it started, I'm the oldest of three.
Hmm.
So just a little bit backstory so you understand like the whole family thought in this.
Hmm.
Um, my little brother, he passed away in August 23rd in 1998 in Colombia. We never knew what he had. My parents took him to multiple doctors. I have an uncle that he was a physical therapist, and he tried like a lot of techniques. But my brother basically he couldn't walk. He could sit until like certain position, and he was able to hold his head. But we never knew what happened, like why he couldn't walk or crawl or nothing.
Hmm.
And he passed away when he was 5.
Oh, I'm so sorry.
The doctors told my parents that they didn't know if maybe my other brother and myself, we were gonna develop this, whatever this was, when we were older, or if our kids were gonna be born with whatever this was. So I had my oldest. My mom, obviously, she was like freaking out during my pregnancy, like, oh my God, what's gonna happen? But then my oldest, he's fine.
Hmm.
So when I got pregnant with Julieta, we forgot about this. So my pregnancy was normal, but when she was like a month, I noticed that she was breathing different. Like I don't know, like she was like agitated.
Hmm.
So I took her to the pediatrician, and the pediatrician was like, yeah, she needs X-rays. I went to the hospital, and they were like, no, you're just feeding her too much because she was very chubby. Like you're just feeding her too much, and that's why she can't breathe. A week later, I took her to another hospital, and they were like, no, she has something. So they admitted her, and that first night, they did an X-ray, and her left lung was collapsed. She was admitted to the ICU. Imagine your 1 month old baby full of like cables and stuff. And it was my first experience like with a hospital, so I couldn't like I didn't want to change her diaper. I couldn't like touch her. I was scared. So the nurses were doing everything, and they started noticing that she was very um like hypotonic, like she wasn't very strong, I guess. But in my head, I'm like, she's 1 month old, her left lung is collapsed. Obviously, that's why she's like this. But they started doing a bunch of tests.
Hmm.
But everything came back good. Then my mom was the one that brought the story of my brother, like his symptoms. And the last test that they did was for SMA.
Oh.
And I got discharged October 13. She was born August 17,
Hmm.
2014. I got discharged of that hospital stay um October 18, and a neurologist called me October 30. Hey, hi, how are you? Are you the mom of so and so? Well, we got the results, and she is a carrier for SMA type 1. That was a Thursday. Can you come to my office Monday, 9:30, of course? And what's the first thing that you're gonna do? You're gonna go to Google. So
Yeah.
I Google what SMA type 1 was, and I'm like, okay, she has what my brother had. And I started crying because I remember, like in my head, it's like, this is gonna be a short stay, what I'm gonna do.
Hmm.
So I went um to see that doctor that Monday, and he's like, well, I'm assuming you know now. And I'm like, yeah, I went to Google. He's like, well, she's too cute, but you already know what's gonna happen. And as a mom, that just broke me. I saw like 4 neurologists more, and they all said basically like the same thing. And it got to a point that I spoke to her dad, and I'm like, we're just gonna forget about this. She's gonna be okay. these doctors don't know. Like I was in the denial phase, I guess. Um, in my side of the family, we had my brother, but in his side of the family, no one until now um has shown like any condition. I did my genetic testing and I came back as a carrier. He's such a kid when it comes to doctor stuff. So he never got checked, but he's like, that's it. I mean, if she has it and you're a carrier, then yes, that's the diagnose. And that's how I found out that she has SMA type 1.
Oh, I'm so sorry. That must have been really hard to find out, especially the newborn.
Yes, it changes when you're pregnant and you're always like you start making plans for your child. And
Yeah.
obviously all of that change in a matter of like a month and a half. So it was hard.
Yeah. I'm really sorry. How do you talk about SMA with your friends, relatives? That must have been really hard for everyone to find out. How did you like release the news to everyone and how does everyone like take it?
Well, it's been a process. Um, and now I can talk about it very normal, I guess.
Hmm.
But at the beginning, I was getting the knowledge too. Um, I think personally, and when I have a talk with another mom, with any kid that just got diagnosed, I think that the process of whatever diagnosis is like you are in maybe denial, then you're like more in what you thought that the life for your child was gonna be,
Hmm.
then a little bit like of maybe like you get mad at the world or mad at the people around you because you just don't feel like anybody understands you. And then that's when you start learning about it. So again, when she got diagnosed, I was in the denial. And then she had, obviously, I read like in Google, like what could happen to her. But then January 3rd, she got admitted to the hospital. She had pneumonia for aspiration. And I remember one of the doctors from the ICU, he just started drawing on the bed sheet, um, and explaining to us like that and myself, like, okay, maybe you read about it, but she's starting with the symptoms. So this means that now, if she's having this pneumonia for aspiration, it means that she cannot eat through her mouth anymore. And now she needs a gastric tube. And now then she's gonna need this, and then she's gonna need that. And then this is what's gonna happen. So that was like the first time that we were like facing reality, I guess. And then, but I was still mad. And then, because I didn't have a neurologist, because obviously I didn't want to stay with the other 4 or 5, they called whatever neurologist was on call that day in the hospital. And when he came, um, I'm gonna be honest, I was very rude, and I consider myself like a very nice person.
Hmm.
Um, but I was fed up, like I didn't want to deal with anyone. And he's like, oh, do you know about this neurologist? But he lives in Orlando, and I used to live in Miami, Florida. Like, well, he has a research for kids with SMA. I don't know anything about SMA, but he knows everything. He can explain you better. He's been studying these kids. So I accepted the help of that neurologist, and he contacted me to the other one in Orlando. And for the first time, I started communication with a doctor that I felt um, he knew what we were going through as a family, and he took the time to, yes, explain us everything. So, like, it's not like the symptoms or the condition change, but for some reason, I felt like hurt and a little bit hopeful. And that's when my mindset started changing. And that's when we as a family, we were able to like, I guess, face this condition for the first time with hope and with some kind of guidance.
Hmm.
So now, years later, I can tell you that not all of us started with the same maybe positive or hope at the same time, because like the anger and the why us and all of that, like everybody lives it differently.
Hmm.
um I can tell you, like, for example, her dad took a little bit more time to accept it. My parents were obviously really scared based on their experience. So, but we started the journey of, okay, what's gonna happen? Okay, she has this, but what now? Like, you're not gonna quit because of your child.
Yeah.
And even though she's 11, we're still learning. This condition is still like in, I guess, in the study process, kind of,
Yeah.
but we're still learning.
Mhm. But that's a really empowering mindset that you have, honestly, to just keep on forth going no matter like what happens. I think that that's a really good trait. What, how has your daughter inspired you? Like, how has she really changed your mindset in life?
Oh my God. I can't even. I was talking to someone about it. I don't remember this week
Mhm.
because okay, she started with this neurologist. His name is Richard Finkel. Um, he was doing a trial for the condition. So we had like no promise of it. Like, we didn't know what the outcome was going to be. And thankfully, this medicine got approved back in December 23rd, 2016. It was the first treatment for this condition. And it's still like a studying process. And there is three more treatments until this date. But again, um, even though she was in this trial, she still needed surgeries. She still needed therapy. She still, needed a lot of stuff. And as a parent, you always question yourself. One, if you're doing enough, and two, if you're being selfish but doing so much. But when it comes to Julieta, she's always been very positive, I guess, and very like, she never complains about everything that she has to go through. She never complains about all the therapies that she has to go. Like, she loves them, actually. um when she has a surgery, I'm always honest with her and I tell her, like, hey, yes, this is what's gonna happen. Yes, you're gonna be in pain. Yes, I'm gonna try to help you, but this is for your own good. Do you have any questions? Do you want? And it has always been like that since she was a baby. um she never complains. She never like argues or gets mad, like, but why do I have SMA? um and she always tries to be positive about whatever. Like, for example, she needed to, at this point she has already two back surgeries.
Oh God.
Exactly. I'm like, oh my God, like, oh, two back surgeries, like, that's gonna be horrible. Like, in your head you're like, but it's her spine, oh my God. So I was like, oh my God, does that mean I'm gonna be finally like sitting straight? Oh my God, so that means I'm gonna pose better for the pictures. And it's like, how I'm gonna complain? Look how she's looking at her life. Yes, let's go get the surgeries. Yes, you're gonna pose better for the pictures. Come on, we're gonna do it. It's gonna hurt for sure, but let's go. We're gonna continue with this process.
Oh, that's so sweet.
When I had one therapist once, like, some years ago, for her
Mhm.
birthday, gave her a wishing bracelet. in your head, you automatically think like, oh my God, maybe her wish is gonna be like, I wish I could walk, or I wish I could didn't have a tracheostomy, or maybe I wish I could eat through my that's what normally somebody will think.
Hmm.
And as a parent, you wanna make her wishes come true. So I'm like, hey, I call her Cookie. Cookie, can you tell me what was your wish? She's like, oh yeah, I want a wiener dog. Like, what you wanna, we already have three dogs. Oh no, but I want a one. I want another one. Okay, so her, like, for her, this is her life. And if you ask her, like, hey, what do you think about SMA, she's like, well, if I didn't have SMA, that wouldn't be me then. So she's taking all of this process as a champ, and every day it's always a lesson at the end of the day.
Yeah. Wow. She
Yeah.
seems really great, honestly. Wow. That's an amazing mindset to have, especially at such a young age.
Yes. Yes. And I'm afraid, now she's a preteen, that maybe will change with time, but no, it gets like more
Hmm.
stronger with her mindset. Like, mom, how about the therapy? Or mom, no, we have to go. Mom, I'm like, okay, but how about if you take like a little bit of a break? Don't you think it's been like a lot this week? We have lots of appointments. So it's Saturday. Do you want to take a break? No, 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 mom, I need to do my exercises. Okay, so let's go and do your exercises. Like she's always pushing herself, and she's already planning her 15th birthday party.
Oh,
Exactly. So it's like, okay, you have goals. I'm gonna help you make those goals, and let's go. If you're strong and you want to keep pushing, we're gonna keep pushing.
yeah. Wow. I think that's a great mindset that she has, honestly. That's more mature than I think most people her age would be.
Oh yeah. Yes. Well, everyone will be in this her case.
Yeah. What kind of support has been most valuable to your family, like such as medical teams or other community groups or parents? What has been most helpful for you to like really hone in on everything?
Well, I learn with the years, and I always advise this to other families. You need to find the right medical team around you. Um, and when I mean the right medical team, it's not the one that knows the most. Obviously, that's very important, but somebody that listens to you as a parent, because you are with your child 24/7. Somebody that it's not just like, oh, I'm the doctor and that's it, but also you cares about your child. There's a difference between a doctor doing its job and a doctor like really caring about your child.
Mhm.
And that they, between doctors, because obviously like there is multiple specialists, that they understand that no one is more important than the other one, and they all are a team, because they all are helping, like in my case, in her case, her body. So pulmonology is obviously, the pulmonologist is obviously super important. But also, obviously, it's important too because it's her back and her hips and like all her bones. And neurology, obviously, it's important too. So it's like they're all a team with me. I take care of her. I can tell you what's happening. And obviously, you're going to give me your input, and we're going to all do a plan for her.
Mhm.
So I think that that's been very helpful, to find the right people on your side, that you feel they understand you. And when you find that support, even like your stress goes a little bit low, and then you can have conversations with your family and even educate them and explain them like, okay, now we're gonna do this. Some of them are gonna have more questions than others. Some of them might not understand the whys, but then after they will come on board. But I think you need to find the right guidance. And it might take time. It took me a lot of time to find the right group of doctors and therapists and everyone. But when you finally have it, you feel like some of that um, pressure, I guess, it's relief, even though obviously you're still going through it.
Yeah. Yeah, that's really nice that you have a good community around you to help support you through everything.
Oh
And
my God, yes.
yeah. Um, what advice would you give parents who just received an SMA diagnosis for their child? What mindset would you tell them to have?
Well, first, um, don't, like I told you at the beginning of the conversation, I think there is different stages, like the grieving, then you're mad, then you're sad, and then you finally you're like, okay, what we're gonna do. First of all, don't think that everyone is around you, meaning mom, dad, grandparents, or whoever. It's gonna leave this process at the beginning, like at the same time, because maybe you're gonna be angry now, but that's still in denial, and that's okay. Um, so first, don't feel alone because the people around you are not leaving that process at the same speed that maybe you are. Um, know that there is hope, and then after, when you're ready, that as a parent, I think you get ready really fast because you just don't wanna um you wanna tackle like the problem. You're like, okay, so what are we gonna do now? Um, again, try to find that support, that right guidance. And how you're gonna know is the right guidance? Because you're gonna feel heard, because you're gonna feel that people are gonna start giving you solutions, or if they don't have it, they're gonna be like, okay, we're gonna look together, we're gonna do the research together. And that's how you know that you have the right people on your side when it comes to medical team. And then how do you know that also they're gonna care when you go to an appointment and they're not just like treating that person, like your child, as one more patient. They're like, okay, what we can do to make him or her feel better. Do you have any questions? We're gonna do this, but this is the reason why, but you have hope, you're gonna be okay. Do you need help? Do you understand what's happening? When they take their time, you know that they care.
Yeah. I think that's really important to have people who really want to make her feel, but you know what I mean?
Yes, yes. That feel, I wanna feel her make heard.
Yeah.
Yes.
What's a lot of stigma that you think is really unnecessary, and what do you think a lot of people should understand more about SMA?
It doesn't, even though it has a lot of challenges, I think the people in the SMA community are very resilient.
Mhm.
And the person with the condition or the family, we always find a way that SMA doesn't, it doesn't, it's not as tragic as sometimes I see that people want to make it sound. Yes, it's a serious condition, but while we're strong and things are changing and things are more hopeful for us, and think the future looks very bright.
Mhm. I
It
think,
does.
yeah, I think with a lot of new research and everything, everything's honestly like
Oh,
really,
yes.
especially now.
Yes. All of the studies, every time, like if they contact me, whoever, it's like, oh, can we get a sample for this for a study? Yes. Yes. I'm pro studies, I'm pro trials, I'm pro everything.
Yeah. How do you take care of yourself in amidst all of the mess of everything going on at the same time? How do you take care of yourself?
Well, I had to learn. because at the beginning you forget about you as a person. Um, I'm not gonna say that I take a lot of time for myself because I don't, but I think that's part of my personality too. But um, try, I don't know. Like in my case, I try, like, uh, I know my limit, and it might not be for, I don't need an everyday thing,
Hmm.
but sometimes I'm like, okay, now I need to at least get my nails done. Like I have to go, I have to get my nails done, and it can be every 3 months, or like it doesn't need to be an everyday thing, but that's when I know I need to breathe. I need my space. I need to forget about hospitals, therapies, pharmacies for a moment. In my case, it's not just Julieta, like I have more kids, so it's more like mom needs a time away. But yes, that's how I find my time. I know some people might need an everyday thing. In my case, it works every once in a while, and I'm fine with it.
Hmm.
So, I mean, I don't mind. But yeah,
Yeah,
that's how I deal with everything.
that's good. I feel like that's important to at least have that kind of self resonating and self-care,
Yes,
especially as a mom. What kind of
yes.
therapies and treatments have really been helpful for Julieta?
Well, therapies, obviously, speech, physical, and occupational therapy. Um, it helps her with, again, it depends on the child. This condition is still on study. Not all the kids, because they have SMA type 1, have like the same symptoms, I guess, at the same age or at the same time. But for her, obviously she needs these therapies always. We just don't, it's not like I take her to a therapy and that's it. When we get home, we do like a little bit more stimulation and games. And then I ask the therapist for tips, like, okay, what do you think, like how I can practice at home? But also like making it like a game, not just like a duty or a responsibility, because at the end of the day, she's a kid.
Hmm.
Um, for her now, for example, for occupational therapy, like her hands, she loves makeup. So obviously it's that help us a lot now that she's into makeup. So she does her skincare routine every day and her makeup, and that helps her with her hands. When it comes to occupational to physical therapy, for example, because she likes to pose, then okay, let's put you on your stander, and then you can pose in front of the mirror and just take selfies, or like I try to like do fun stuff, and at the same time she's doing therapy. I don't know. And when it comes to speech, she is a social butterfly. She likes to talk a lot like her mom. So so for example, if she has an appointment, we're always early so she can socialize with other people, and she can, I let her talk to people and do her stuff, look, use her speech device if she likes to, even though lately she doesn't like it that like she wants to do it herself, not through a device. But that's another story. That I maybe that's part of the preteen years. um but yeah, it's those therapies have helped her a lot. And obviously the medication that she's on for the SMA, which is Spinraza, that was the trial that she started back in 2015, and then it got approved. So it's just a group of stuff, plus, her medicines and
Yeah.
her respiratory treatments. But that for us is just like the normal, like the routine.
What advocacy do you think is most important for, so especially children with SMA or children with other neuromotor disorders? What advocacy do you think is really important for that?
Wow.
because a lot of people like don't like understand that it can affect like kids too, or
Anyone, yeah. Um, well, honestly, it starts at home. It starts with I now I understand that not everyone has knows someone with a disability. So I cannot expect that everybody's gonna know how to treat my child or my child needs. So I try to educate, I try to be very vocal with the people around me that it's okay to ask questions, that I prefer that people ask questions. I just that they just don't assume whatever because of how they feel, whatever they read. Um, because not all the information on the internet is right. But I think it starts a lot with like a home.
Mhm.
We advocate for the child. We are the voice of the child, and we educate the other people.
Yeah.
We cannot just assume that they're gonna know. And even in my case, I can't advocate for what I'm living with my child with SMA. But for example, another parent that has a blind child, I don't know about anything about how that child, what that child needs.
Mhm.
So then I go to the parent if I encounter like that situation.
Yeah.
For example, Julieta, again, my social butterfly. One time we were doing the line of the registration in the hospital, and she saw a girl with like doing sign language, and she asked me like, "Oh, mom, what is that?" So I like the mom was very busy, so that's why like we didn't ask. And obviously, I think that if you're gonna ask questions, yes, it's okay to ask questions, but like in a polite way too. And the right moment, like if her mom is busy, it's a registration line for an appointment, like no, obviously she's in a hurry. But anyways, I try to explain to her for whatever information I knew. Then we went to another speech therapist that knows about sign language, and we asked her more questions. And then because she wanted to be in communication with everyone, Julieta started learning about sign language. She knows about sign language now. I didn't teach her. She went to Google. She started Googling sign language. She came across to one lady. She's really good. And now she knows a lot of sign language and she can talk to anyone.
That's so sweet.
Yes. So I think that again, the advocacy starts at home, maybe.
Yeah. I think that's a really good answer. You should empower your kid to, learn everything and that. Wow, that's a nice story. Wow, she sounds really nice.
She is. I mean, it's my child, but yeah, she is.
Yeah. Well, thank you so much for being here and answering all these questions. I really appreciate it. I know life is super busy, so I really appreciate it. Thank you.